I'm Dr. Susan Zbikowski from Insights Consulting. I'm a behavioral scientist who specializes in working with companies. I help them implement evidence-based best practices to improve the health and well-being of employees.
We hear that employers are concerned about the emotional well-being of their employees. They're expressing concerns because they're seeing that mental health concerns are on the rise. They're concerned about engagement among their workforce, and then how substance use and other issues are affecting overall workplace safety. We're even seeing this in mainstream media. So many of you might have seen this in the news trending at the end of January, early February, where the character Elmo went on the X platform and sent out a tweet saying, Elmo is just checking, how's everybody doing? That one tweet resulted in over 200 million views and tens of thousands of people responding. And the responses were quite grim. Individuals wrote in saying how they were feeling poorly, that their mental health was not well. So I think the audience pretty much knows, because as you came to this topic, that this is of great concern. And so what I wanted to do next is to cover a little bit about the landscape of mental health in the workforce. Mental health concerns are quite common. About 1 in 5 employees experience a mental illness, and many others have mental health concerns. So that can also include things like feeling stressed, having anxiety and some depression, or just feeling lonely. And so it doesn't necessarily mean that somebody has to have a diagnosis. It can also just mean that you feel emotionally unwell. And left unaddressed, it's incredibly costly to employees, their loved ones, and to the employer. And so what we see is that it costs billions of dollars for employers when this is unaddressed. And so that can range from lost days due to absences, or also excess healthcare costs that are attributable to the conditions that mental health is linked with. Sadly, the majority of people do not receive care, even though they may need it. And there's a variety of reasons for this. So first of all, there's the stigma associated with having a mental health concern. So even though we've made phenomenal progress over the last decade of starting to normalize that mental health concerns are common, there are still employees who don't feel safe talking about this. And so this is going to tie into the concept of psychological safety. So there are employees who don't feel safe talking about this, and employees who don't feel comfortable getting help. But in addition to that, the demand exceeds capacity. So there are often long wait times. And as a result, individuals who are in need of it, who want to get help, in fact, can't get help because there's too long of a wait time to go in and see a practitioner. So we're going to talk about this. We need to do more. In addition to the concern of mental health issues, there's also employers are quite concerned about substance use disorders. Many of us may in fact know people, because 1 in 6 individuals have a substance use disorder. And so this can include use and abuse of alcohol, prescription drugs, illicit drugs, other kinds of substances. And the reason why this is so important, because again, it affects our employees, it affects productivity and performance. It leads to consequences in terms of one's overall health and well-being, as well as it co-occurs with mental health conditions. So what we see is that individuals who have a mental health condition are far more likely to use and abuse substances. Likewise, individuals who have a substance use disorder are more likely to have underlying mental health issues. Now, I want to turn to what the impact is of mental health concerns on employees. So it takes its toll on employees. Mental health issues in terms of stress, anxiety, and depression take its toll on employees. And in fact, today, more employees miss work due to mental health reasons than they do to physical reasons. So there are more days that are lost due to mental health concerns than there are due to injury and physical illness. And when employees are surveyed, they in fact reveal that it affects their overall performance. So when they do actually come to work, they're not feeling that they're at their best. And employers are reporting, as we saw in those headlines, employers are reporting that they're seeing a rise in mental health concerns. So a recent survey that came out from the National Business Group on Health showed that nearly 80% of employers are reporting that they're experiencing an increase in mental health concerns among their employees. And even when employers are actually doing quite a bit about this, employees still feel that more can be done. The majority, almost 90% of individuals, feel like their workplace could do more to address mental health concerns. So I want to explain just one more thing about the complexity of mental health care in the United States before we go into talking about how to create a culture of care. So one of the challenges, as I mentioned, is that many people don't receive care, despite the fact wanting it. But I do want to also cover that many people actually don't have benefits to cover mental health care or addiction care. So only 2 out of 5, or 40% of employees, report that they have benefits that cover mental health and addiction benefits. So 60% of individuals do not have coverage or adequate coverage. And then I often hear this when I talk to employers, that even when you have great benefits, often people aren't aware of benefits. And so, we continuously need to remind employees of what they have and what resources there are. And you're going to see this theme later in my presentation as well. And sometimes it's obvious because you don't need to think about your benefits until you need to use them. So it's at that point that you're trying to figure out, like, what do I have, right? And if you've ever read one of those benefit summaries from an insurer, it's as clear as mud sometimes how to interpret those. So I can speak from personal experience, just how hard it is to navigate the system. And that brings me to the majority of individuals feeling overwhelmed about navigating healthcare. So whether you're ill mentally or physically, it can be very difficult to navigate healthcare. You need to find out if you have coverage, what's covered. Do I start with my primary care provider? Do I go to urgent care? Do I see a specialist? And then when you finally have figured it out, you might have to wait months to get that care. So, I just lay that out so that you can understand that it's not all about what we're doing in the workplace. There's also problems in our healthcare system that make this complicated. And so some of these things may not always be solvable. But let's talk about what employers can do to promote employee well-being. How do you grow a culture of care, and what is that? So first of all, a culture of care is an organization that encourages employees to speak up and to contribute. It is an organization that demonstrates concern for the health and well-being of organizations, for their employees. And it encourages employees to show that they care and that they have concern and respect for one another. And so it's part of that culture. It teaches individuals how to talk and listen with respect for one another, and then also how to remove obstacles to getting help and helping others when they need it. And then I would also say one more thing related to organizations that show a culture of care is that they show employees that they respect what they contribute to the workforce. A lot of employees often will communicate that they don't feel that they're valued or that their employer really understands what they can contribute. So the more that you can do that, that's also supporting a culture of care. So I wanted to share with you an example of something that Gomo Health is doing, the Recovery Pathway Program for workplaces in a culture of care. And in this example, what you'll see is that Gomo has put together all of these best practices into a program that's related to recovery. And so, we acknowledge that there are many organizations that are concerned about substance use and substance use disorders and misuse. And in this training, what we've been able to do is to help educate all employees, to have specialized trainings for supervisors, and then to provide additional resources that will help employees to actually address some of the concerns that they may have on their own. And this includes everything from having screening tools that people can use, because sometimes employees may feel like, is my behavior healthy or unhealthy? And by having a screening tool, you can allow employees to explore maybe a concern that they have. And then from there, build to where that can connect them to resources that you have in your company. And so the idea through the connection to resources to help employees to develop resilience and coping, and healthy behaviors that prevent people from turning to unhealthy substances as a way to cope. And then through this program in the toolbox, there's also the idea of how you engage HR leaders. And this involves looking at what policies you have, how this connects back to the benefits that you're offering to employees, and making sure that your leadership is aware of this. But in this approach, it's designed with the audience in mind. So there is a track for all employees to learn about this topic. This is, again, ties into the fact that it is important. This is showing how this is a priority for your organization. And when you communicate this, that something such as recovery, substance use, and mental health concerns are important to your organization, it can help to alleviate concerns about a stigma. And then it can start opening conversations and encourage employees to become aware of what resources are available and how to get into treatment. So all of that can happen in an employee track. And then with a supervisor track, what happens is that you're teaching those additional skills that are relevant to those individuals who are responsible for delivering the policies at your organization and making sure that people are complying with those policies. So training can cover, as you see here, how to engage employees in conversations around these sensitive subjects. So all of that is in this recovery pathways for workplaces training. But then after that, people are actually signing up to get ongoing appropriate information based on their job role, because this is not a one and done thing. To transform an organization, you can't just sit down in 15 minutes, say it's part of my policy, and implement it with the training and expect the next day that your organization has changed. You really do have to support that transformation and think about the change in workflow. And so allowing people to sign into different kinds of tracks where they can get ongoing support. And in this case, it's through messaging on their phone and a library of additional content. Employees can then get directed to resources that they need based on their role. And again, whether they're in recovery or a supervisor trying to support someone, or even somebody who's trying to help somebody at home that's a loved one. So just giving you some examples there. And then lastly, based on a recent pilot that was done, we have some data that shows some of the early changes that are happening. And so after doing just that initial training without having all that ongoing messaging, we see that the majority of people are saying that the program made them feel less stressed, that it connected them with the resources that they needed, that they feel more comfortable navigating challenging situations in their life. And then we see a certain percent, ranging from 6 to 11% of employees, saying that they're better able to access their benefits, that they know how to handle these challenging topics, and then that they would be more comfortable asking. So starting to see the signs of more psychological safety among this workforce. So to wrap up, what can you do as a leader in your organization? So again, the takeaways are to first really start with what you have. Review what you have in place, because you may have a lot to leverage. And then make sure that your organization is making a commitment to a culture of care. There are incredible benefits to your individual employees, and then also to your overall bottom line. And one of the ways to do this is, if it isn't already part of your company values, is to meet with leadership and talk about the importance of making this a company corporate value, that you want to have an environment that is psychologically safe, recovery friendly, mental health friendly. And then work on a campaign that fits for your organization to create awareness. And so that can happen through resources that you might already have in your team. Some of it may be through training. Some of it may be just by having an ongoing campaign to say, this is important to us, and you talk about it. Of course, you can refine your policies, look at your benefits, plan on very focused skills-based training. So this does not have to be something where people are tethered to their desk. Instead, it can just be some tools in the toolbox to help individuals think about different situations that they may encounter, and to be able to role play through how they're going to handle that. And then I'm just encouraging you to really think that it boils down to the basics. And the basics are to encourage your leaders to care, to promote discussion and contribution. So that's asking and discussing, and then to continue to encourage that. And so, you can encourage that by vulnerability. You can pull that out of people. And then as somebody who's trained as a scientist, I think it's always good to measure where you were at and then measure progress.